ectopic pregnancy is really is really pregnancy. It's really fetus, but the thing is, it's outside the uterus. It's in the fallopian tubes, or if they're twins. So these are other possible cause of higher increasing level of HCG. But then again, nurses, they are not confirmatory that you're pregnant. Okay, so what are other probable signs, Mr. Arado? Like the term belotment. Well, this never came out in NCLEX. This never came out in NCLEX yet, this term belotment. But what is the keyword for belotment? Fetal rebounding against the examiner's finger. So when the doctor palpate, the outside, uterus, okay, or in the abdominal area, and the patient feels that something is moving inside, is belotment, okay, or a Braxton-Hicks contraction, wherein there's irregular painless contraction intermittently. So, those are example of probable signs. Never came out in NCLEX also. Now, look at D, E, and F. Hager's sign, Shadwick's sign, and Goodall's sign. Hager's sign is softening of the uterine segment. Shadwick, let me skip Shadwick. Hager's sign and Goodall's sign. Hager's sign is softening of the uterine segment, while the Goodall sign is softening of the cervix. So don't confuse those two. Okay? So remember the structure. You have the ovaries here, you have the fallopian tubes, you have the uterus, then you have the cervix. Okay? You have the cervix and you have the vaginal area. Okay, so Hager's sign is in the uterine segment, while Goodall's is on the cervix. Okay, Shadwick's, the keyword there is purplish discoloration of the vagina. Why is that so, Mr. Romano? That is because of the growing fetus that is compressing the veins there. Okay, if you try to do this on your fingers, I don't know if you did this when you were like younger. So try to constrict your finger here. After 5 minutes, it will appear bluish or purplish. So that is the same thing in the pelvic area. Since the fetus is growing bigger and bigger and bigger, so it compresses the veins that causes the genital area to become purplish in color. Now, Mr. Arado, look at uterine enlargement. When it gets bigger, I know that patient is pregnant. But like I've told you, in H mole, this causes the uterus to get bigger as well, but it doesn't mean that the patient is pregnant. So that's why enlargement of the uterus is just a probable sign. Now, Mr.